Paul, I see why you're the man to run the team. I mean, I'm pretty sure that's also good people around you, but these ideas that you're saying, it doesn't happen often. I speak to a lot of people in this space, and you're really ahead of the game. I mean, from the hospitality part to the AI part, is there anything else that really separates you guys from the rest of the individuals?
Well, you can talk about, we have a meeting that Kara has organizes quarterly, and we call it Culture Cultivators. And it's our mid-level management, but you might talk about how we do that.
Sure. So it's C2 for short, or Culture Cultivators, and we really wanted it to be a beginning point or a starting point for our culture. One thing we know in healthcare, and I think that it's pretty much across the board nationally, that our frontline staff, they trust their manager, but they don't trust administration. So the gap is really big from administration to someone who's actually giving the care. And so as a way to try to reduce that gap, we created a quarterly meeting with the middle management team. And we have the administration talk to that middle management team. And they share, this is what's happening in my organization. Transparently, this is what we're making and losing as a hospital system. Here's what I'm doing that's making your experience great to be at work. Here's an idea we heard from you that we're implementing because of something that you said. And showing them that we're listening and implementing all those things. And then they're able to take that information from that meeting and tell their frontline staff, guess what? I heard from the CEO today. I heard from his leadership team. They gave me this to give to you. And so they have team huddles and they share that information. And so we've seen that gap shrink tremendously. So much so that year over year, our employee engagement scores grew by 57%. And I know it's not just that meeting, it's all these other things we've been talking about, Efrain. It's, the engagement, it's the leadership academies, it's the president's forum, it's these other opportunities that we're providing. But being able to shrink that gap and let middle managers know that we had their back and we're communicating with them truthfully and honestly, and that we're listening to their feedback and incorporating it into what we do every single quarter, it really made a huge, huge difference. And so those meetings now are just, they're places of fun. They're places of engagement. People look forward to them. They feel left out if they can't come and they want to join virtually, even if they're off on PTO. And then as a secondary matter of that, we've created a speaker series as a kind of an off-cycle meeting. And so we'll bring in executives from various industries. We've had executives from aeronautics, from IBM, from Navy SEALs. We've had former shopping executives and sausage manufacturer executives come and talk to this group of healthcare middle managers and directors. But the thing that we really try to get across is, what does it take to be a leader? What does it take to build a great team? What does it take to provide a sustainable culture, to build trust, authenticity, to deal with change in a transformative environment? Because if you've been in the same job for 20 years and something's being done differently, you may not want to do it that way. Yeah. So helping leaders get okay with that, or their team. And so that's been a really fun component that we've added on to. This just created kind of a cross-functional awareness, education, and then just a culture bolster.
This is so good. Like, you guys, this just to hear where you guys are at, it's so different than anybody else that I'm seeing. Paul, were you always in Naples, or did NCH?
No, I spent my whole career really in Ohio. Up until 6 years ago, I was recruited to come here because of a change in leadership. But I was in Cincinnati and up near Dayton and then near Cleveland. And I was happy to come to a warmer climate. So I really enjoyed the sun of Florida, even though I love Ohio State football. But it's fun to be in Florida, where there's a lot of growth and a lot of opportunity. We're having some great innovations here, and the population's growing. It's a great environment for healthcare, I think. And so it's a great place to be. And it's a great time to be in healthcare, too, with so many innovations and so many things we can do for patients that we couldn't do as recently as 10 years ago.
Yeah. You mentioned what does it take for a leader? All right, what does it take to be a good leader? What does it take? First of all, I want to go back to the fun part. I have on the board that I sit, one of my board members always says, Efrain, if it's not fun, it's not going to get done. Right? So bringing that fun into what you guys are doing allows people to really get engaged. And now it's getting done. The things that you guys want is getting done because you brought fun to it. So I actually love that. I love that you guys start beyond just the C-suite level, right? You guys truly thought about at the bottom line, because you remember what it looked like when we first got started. I say we, I didn't get started. Healthcare, by the way, is not my thing. Want to know why? I'll pass out if I see blood. That's why. Not my thing. Okay, when my wife gave birth, they almost needed 2 doctors in there. One for her, one for me. I almost passed out.
That's
But
great.
what does it take, back to that leader question, what does it take to have a good leader? You guys been in this space for so many years and probably worked with some that may not have been so good, but what does it take?
Well, I'll tell you, when we spend a lot of time interviewing when we have a new teammate, and we look for things like inquisitiveness. Is a person curious? Are they interactive? Do they listen? Because we believe in healthcare, listening to the patients is just so critically important. So we look for people like that. We look for people that come in with a problem-solving mentality, people that can work well in teams, because in healthcare, very difficult to do anything on your own, including the CEO. The CEO can do very little. It's really, healthcare, we believe, is a team sport. So you're looking for people that have demonstrated they can work on a team. We look for athletes, because people that have played on high school or collegiate teams is a good background. People that have solved problems, and they don't necessarily have to come from healthcare. They can come from other industries. In fact, we think that's really important right now, to have a diversity of background. So those are the qualities that we look for, and we have an interview process that includes multiple stakeholders here, so that we look at a person from all angles, right, Kara?
Mm-hmm, yeah, and we do try to kind of take them around. It's not just a one-time interview. It's multiple days. It's multiple types of situations and scenarios, just to make sure it's a good fit. Because if you don't fit the culture, you're ultimately not going to be successful, and so then it's our loss and theirs. And so we want it to be, easy from the time they walk in to the time they get started and feel enmeshed. The other thing I think that's important, while we do try to look at talent from outside our pool, the other thing that Paul's done a really great job at is really promoting a culture of promoting from within. And so, the leadership forum he was talking about, it's called President's Forum of Excellence. It's one avenue to help our team do that. Another one is our Physician Leadership Academy. And while they're not being promoted necessarily, they're growing their skills and they're getting cross-functional teamwork with physicians from other areas within the hospital. And then we do the same thing in our nursing capacity too. We have learning and skills training for them, their first year of nursing all the way through to the time they've been here for 20 years. And so just helping those nurses and those team members really get acclimated to knowing how and what it takes to become that next level leader. We're trying to share that information with them. And we're in the process too, because of this culture, of creating a leadership boot camp. So when you go from being just a frontline leader to all of a sudden now you have to manage a team and all of the downstream impacts that come with that, learning how to manage a budget, or, deal with someone that needs FMLA, or, manage up for a very difficult personnel issue, or learn how to lead a one-on-one, anything like that, from very simple to a little bit more robust, trying to really equip those leaders so that they feel prepared to step into that leadership role. Not just because they've outgrown the role they're in, but because we're helping them become that next level leader and coach.